All right, hello everybody. This is Craig Egan. I am in Idaho Falls. We're waiting on the vaxxed bus. They're not quite here yet. Maybe they're having some bus issues. But I'm here with Amy Garnett, and she works with the health department here.
Yep, Eastern Idaho Public Health.
All right, and can you just tell us quickly what you do?
I'm a division director there of Family and Community Health Services.
Okay, and what's your opinion about the vaxxed bus and the whole anti-vaccination movement as a whole?
You know, as parents, we're concerned about, children, and the anti-vaccine and the vaccine movement both. We can agree that, we both want what's best for our children.
Right.
Wakefield, his study has done a lot of damage, and now I believe that this vaccine part of this movement is just a way for him to try and to kind of redeem him, his reputation. His study was rebuked, and he. Every co-author that did those articles with him has pulled their name out. So he's come to the United States, I think, trying to...
trying to cash in, right?
Yes, trying to cash in. Yeah. So bottom line, I think it's propaganda for money and reputation. That's my personal opinion. I still feel for that.
Yeah.
And it's hard because he does tug at heartstrings of parents that are looking for reasons for maybe injury or harm that has happened to their kids. And so it's emotional. It's very emotional. And that's hard to get around. It's hard to get around to this science when you have a child that has a disability or an injury in some way.
Right. So when I look at somebody like Wakefield, I see somebody whose medical license has been revoked and now makes his entire living off spreading anti-vaccination propaganda. Is that fair, you think?
Absolutely.
Right?
Absolutely. Again, I said that it is propaganda.
Yeah.
I've watched the movie, and it's propaganda. It's elusive. They've made it the wow factor.
Right.
Again, just trying to tug at those heartstrings. But it's exactly what I just said. It's a movie. It's based on fiction, half-truths, not fact. I vaccinated all 6 of my children. I know that's the best thing I can do to have them in a world where diseases are out there. That's the best thing I can do is protect them.
Yeah.
I've done the research. I would not make that recommendation lightly to anybody else, to your child, anybody else's children, if I didn't firmly believe that and stand by that.
Yeah, exactly. So the one of the rumors going around, or one of the lies that the anti-vaxxers like to push, is that doctors who push vaccines on their patients don't actually vaccinate their own kids.
And untrue.
Untrue? You don't think there's any truth to that?
There isn't, especially for me. When you talk about emotional, it is emotional for me too. I've done the research, I've looked at the studies, and Wakefield, got paid to show that 12 kids got autism. There's studies with 96,000 kids out there that show no link between MMR and autism. And so no, I chose to vaccinate all of my children, and now my 4 grandchildren. I vaccinated them as well, again, to have them in an environment where there's still diseases unless they're completely eradicated.
Right.
That's the best protection I can give them.
Yeah. So one of the things that I heard Polly Tommy, one of the producers of the movie, claim in a Q&A was that doctors know that vaccines injure children, and they're doing it on purpose because unhealthy children are profitable, and they don't want unvaccinated kids in their clinics because they don't make any money off of them. In your experience, do you know many doctors who would go for a financial deal like that? You can make $300,000, $400,000 a year as long as you poison kids on purpose?
Yeah, absolutely not. I do not believe our physicians go into the medical field to make people sick. They chose that medical field to make people better or have them healthier. And I have a lot of physicians that I work with in this movement as well, the pro-vaccine movement. No, they're emotional. They're vaccinating their children as well. They know same thing. That's what's going to keep that child not in there for a rotavirus illness that's going to have them in there receiving IV therapy, or Haemophilus influenza that's going to have them in the ICU.
Right. So even if they threw in a Porsche, or maybe a summer home.
Just an untrue statement. Again, that sounds like a movie thing somebody would say to me again as well.
No, it's so weird because the anti-vaxxers paint this world where every doctor's a Bond villain, and they're just purposefully poisoning kids so they can rake in the cash. So doctors aren't out there poisoning children is the takeaway I'm trying to get from this.
Absolutely not. Absolutely not. And let's just say in a world where we even allow that to happen in the United States, there's all the studies that also show vaccines are safe, safe and effective. So even if that was a true statement, which it's not, there's nothing to even back that up that that's what's happening.
But I think even that worldview kind of just assumes that the U.S. is the only country in the world. There's a lot of countries with completely socialized medicine, universal health care, where there's absolutely no incentive even probable for that to happen, and they all vaccinate, every country.
Right, and you look at studies going back, in the 70s, I don't know if you look at this, Japan, pulled DPT off the market,
right.
The high fevers back then, and within 3 years they went, oh, we need to start vaccinating again because of the amount of pertussis they were seeing and the deaths from that.
Yeah.
Within 3 years, so that's just 3 years of pulling a vaccine out of a country, came right back, and that was in the 70s, they were able to see the effectiveness of that and the importance of that. And then it saves lives, vaccine saves lives, build down right.
Right. Awesome. Well, I appreciate your time.
Yeah.
Thank you so much for coming out.
Yeah.
We're going to follow the Vax bus around the country and try to just talk to some reasonable people, get some
and good luck.
Get some conversations going.
Appreciate your cause.
Thank you so much.
Yeah.
All right. Thank you. We'll see you soon.